Thank you very much for listening to me. Welcome again to the next episode of addiction. The last time I talked about addiction as a disease. In continuation, I would like to tackle the dynamics of addiction. And I'd like to tackle two: craving and loss of control. This also can be called a characteristic of addiction, what determines what addiction is, especially to substances. Craving is the need to use. All the time you want to quit, but you still need to use. Then it brings in the aspect of loss of control, meaning you cannot manage your own addiction. When somebody gets into the phase of treatment, there's what we call the detox phase, where the client is stabilized so that he can get into the other phases of treatment. Usually, treatment can only be successful when one accepts, as I said the other time, the desire to quit. And that is what an addiction counselor would like to instill in a client by bringing more awareness to the client to understand that he or she is sick. Now, the craving patterns determine how much somebody will be successful in his treatment or have a positive treatment outcome. Loss of control, can be contained by getting somebody into a counselor, professional counselor, or a treatment facility. But when we're doing our treatment planning, it's important to understand all this so that we can be able to detect if there is another problem, if there is another problem, so that we do what we call the dual diagnosis to help us have a positive treatment outcome. People or individuals who are struggling with substance abuse or struggling with addiction often are not accepted at home. And that's the reason sometimes they are isolated into rehabilitation centers. People in the family need to understand who these clients are. And so there's what we call the family awareness or the family therapy for the members of the family or the significant others around the family, because the client will integrate with the family once he gets out of rehab. And so a key thing that causes this is called the lack of awareness in families. When a client relapses, he gets into use, then the craving patterns come and the loss of control come. And so we call this relapse. And so to fight relapse as a form of relapse prevention, we need to involve family. Somebody who is addicted to drugs or who is struggling with drugs may be having other issues in life that needs to be tackled. And so, as I said, there is always a desire for somebody to quit. But all this is coupled by help in a facility or by a professional to help the client come out of this. Now, what dominates all this is acceptance. Once somebody accepts, then it becomes very easy. We have had cases of involuntary admission in rehabs. This causes a big problem because it's difficult for somebody to accept his condition. Maybe he's been brought there because of some reason, he's not loved, or they're trying to put him somewhere because he cannot be put anywhere, he cannot be placed anywhere, he cannot be locked anywhere. And so the family needs to come to the knowledge of understanding that this person has a problem. I talked about the X factor, I talked about the progression of this disease, but the key factor here is acceptance. And so for us professionals, we use what we call the motivational interview or motivation enhancement therapy to help the client come into terms with his condition. If somebody has not come into terms with his condition, then it's difficult for that person to get to a normal state, what we call recovering addict, or to come out of rehab with a successful treatment outcome. And so when you understand the characteristics of addiction and the characteristics of an individual, then it's very easy for us to intervene or to get a plan of intervention that will help this client to stabilize. And so we have the 12-step program, we have the Alcoholic Anonymous Fellowship, we also have rehabilitation. But the most important thing is the family input that I want to stress on. The family needs to understand the sickness of the client, because all the family members are sick when they have somebody struggling with addiction. So the knowledge of addiction needs to penetrate into the family, so the family also understands, so as not to enable the client to get into the condition that he's trying to fight with. So many people who give prophecy, who give testimony about, when they give testimony about themselves, they talk about the family getting involved in their issues. And so interacting with drugs maybe in the beginning was because somebody wanted, but the family does not handle the person well, and this makes this person get into continual use by having resentment about the family, by having hatred for the people who hate him. So in return, this person is. So it is important to know that addiction is a family disease. It's important to know that this is a family disease. It runs in families, but it also affects the family. So my important point is that all the people around the client need to understand the dynamics of addiction. They need to understand what addiction is, so as to be able to help the client. It is something that is done by team players. We need to play our part as people in the profession, as the family and the other people. So everybody has a part. The doctor has his part, the psychiatric doctor, a counselor has his part, family has their part, and all these others. So if you want to prevent this disease, if you want to help people suffering from this disease, they need to start early in the community. And in our country, Kenya, we need to get this education more and more and get people understand that this is a disease, it is a progressive disease, it's a family disease. It affects the individual, but it also affects our community, because if somebody is this kind of a condition, it becomes very difficult for family members, especially the significant others. I'll continue more on this topic in the next session. Thank you very much.